fistula itself is a very difficult, but in that there is something called simple fistula and complex fistula. It depends upon two main factors. That is, one is the risk of recurrence and risk of incontinence. If any fistula surgery leading into a chance of again getting the fistula or the chance of losing the control, those are called complex fistula. Simple fistula, if during routine standard surgery, there is no chance of incontinence and chance of recurrence are less, are called as a simple fistula. If we look at the causes of fistula, there are many, simply from the cryptoglandular theory to tuberculosis and all the things. But every patient when come in the OPD, they ask why fistula is developed to me. For that, there is a standard answer is anal region. To keep it wet for passing normal motion, there are anal glands which secrete the mucus and they keep the anal area wet and lubricated. But because of some constipation, some unhygienic practice, these glands get blocked off, and because of blockage, they develop the abscess, and that abscess either by drainage surgically or by a self rupture will convert into a fistula. That's what the reason for the fistula formation. Other than this theory, there are many things, TB or Crohn's or malignancy, they can cause the fistula. Other than that, patient may have perianal pain, patient may have perianal swelling may come, but pus discharge with a wound is the classical of fistula. The diagnosis of fistula for any patient is very simple. If you are having perianal wound, that might be one opening, that might be multiple opening, and that is discharging pus, it's almost 90% that pus discharging perianal wound is nothing but the fistula in hand. If the person has been diagnosed with a fistula, then other than surgery, there is no treatment. There are multiple modalities of treatment for treating the fistula. There is a standard surgery in simple fistula is completely opening the fistula and allowing to heal, which is the standard treatment. But in a complex fistula, if we do that, it will come with lot of trouble. For that reason, there are many different procedures like lift, waft, phylac, and laser. And nowadays, it's a stem cell therapy, expensive therapy. Those are treatments available for any kind of complex fistulas. Any procedure at the perianal region are painful, but pain can be reduced by expertise, by using lot of perioperative technique, such as there is available medicines to reduce the pain, so that initial 5 days you may have very less pain, where initial few stool frequency will come with lot of trouble. And also use of newer technology, highly advanced energy kind of lasers and other modalities are there. It's a surgeon domain. By that we can reduce the pain, but it's true that pain can be less, but it's never painless surgery. It's always have some pain. The pain intensity may differ person to person. Pain susceptibility may differ person to person, but definitely by doing better surgery in expert hand, pain can be reduced significantly. If you have underwent any kind of fistula surgery, then you need to know that this will come with the cost of perianal wound. If there is a perianal wound, this is an area where we are daily passing waste material, means fecus is going daily and it cannot be held on. Because of that, any perianal fistula surgery, let it be simple, let it be complex, on an average it will take 1 month to 3 months to heal completely, to recover. Initial few days, the person after surgery will have pain. Sometimes there may be a bleeding episode may come, but complete healing will happen 3 months. But at the end, I will stress on one thing. If after 3 months you are having persistent discharge from that wound, it's likely the fistula is not healed or it has recurred. If we are eating, it's about the fistula or any perianal condition. If you don't want to land in like hemorrhoid, fissure, fistula, the most important thing is eat good diet, eat on time, have more fiber like fruits, vegetables, sprouts, nuts. Lot of you need to have adequate water intake, kind of drinking 2 to 3 liter daily water, so that your stool will be bulky and soft. Many of the colorectal disease, including fistula, can be prevented by this, and also have adequate activity, physical activity, that also will help lot. Fistula can be prevented at the start if you are having proper bowel frequency, you are not straining for motion, that's constipation, your stool are soft and bulky, the possibility gland getting infected leading into fistula formation is less likely. Only way to prevent the fistula, avoid the constipation.